Hello and good evening. Welcome to Vax Facts and FAQs. Vax Facts and FAQs is a virtual discussion on how to stay healthy and get up-to-date information on flu and COVID-19. This month we are discussing some COVID and flu updates, the updated recommendations, the updated/simplified recommendations, I should say. We'll touch on long COVID, and we will talk about COVID and LGBTQ plus health in honor of Pride Month, and we will end with our frequently asked questions. So like I said, starting with the updates, I just want to remind everyone, we kind of talked about this last month, that due to the end of the public health emergency, the Department of Health and Human Services will no longer have access to certain data from labs, which will affect the reporting of certain COVID-19 data. So in a nutshell, we are getting creative on how we can track COVID-19 and kind of infer some things from the data that we do have. So for example, for hospital admissions, we are able to track the spread in communities and the severity of illness. For death certificates, we are able to track severity of illness. Emergency department visits, we are able to detect early signs of spread. And with genomic sequencing, we're still able to track and update everyone on new variants. So the data that we do have access to, like I said, we are able to draw conclusions from, and that's kind of where we're getting these the data for the next slide. So if we look at this slide, we'll see that hospital admissions are low in a lot of places, including Michigan. So, drawing back from that last slide, admissions are low, and this indicates that spread in communities are low. So you can see there is a higher rate of hospital admissions here in Nevada. I think that's Nevada, testing my geography skills. But so in that county, this would indicate a higher community spread of COVID-19. So next we'll talk about the flu. So currently the flu season is active in Australia. And the cool thing about that is that because it's before ours, well before ours, we are able to utilize it as an indication of how severe our flu season will be come September. So right now in Australia, they're currently experiencing higher and earlier flu activity compared to the years prior to the COVID-19 pandemic. So we can use this as an indicator, and it's early in their flu season, so we can continue to monitor their flu season and utilize that to shape how we are going to respond here in the US. So with that being said, the flu season could come back strong for 2023 and 2024 season. So it's important always, every year, to get the flu vaccination. The more of us that do get the flu vaccine, the more protection against flu spread and severe disease and fewer deaths in our community if we are encouraging vaccination in our communities. So while we're thinking far ahead about getting our vaccines for flu, it's important to know that if you're interested in kind of locating your vaccines and where you're going to go and plan that ahead. Or maybe you need a COVID-19 booster or starting your COVID-19 series. You can go to vaccines.gov. You can text your zip code to 438829, or you can call the number there on the screen. And this will allow you to locate vaccine providers near you, where it's in stock, where it's available, which vaccines are available for COVID. And so you can be well prepared for flu season. And like I said, if you need any COVID-19 shots. Speaking of, we can talk about the updated recommendations for the COVID-19 vaccines. So there's been a real initiative to simplify the language, simplify the recommendations. And I think we can all appreciate that. Now that it's settled, now that it's somewhat final, we'll move on, and we don't have new information coming out so rapidly anymore. Now we can simplify the language and really narrow it down so that it's easier to understand. So for individuals 6 to 64, it's recommended that you get one updated COVID-19 vaccine. Everyone 6 and older should get one updated Pfizer or Moderna vaccine, regardless if they've received any original COVID-19 vaccines. Individuals 65 and up may get a second dose of updated Pfizer or Moderna vaccine. People who are moderately or severely immunocompromised may get one additional dose of an updated COVID-19 vaccine or 2 months or more after their last updated COVID-19 vaccine. So it's important for those who are immunocompromised, moderately or severely, to talk to their healthcare provider to get the best recommendation. These are general recommendations, but your care team will be able to answer your questions and make a more specific plan, and make sure that you're prepared for what the recommendations are going forward. So like I said, and this is a good tip for everybody. There's a lot of people providing updates and informations, but if you want a trusted source, a consistent source, you can always count on your healthcare provider to be that for you. All right, so we'll talk about COVID and LGBTQ plus health in honor of Pride. And I think it's important to know that as we've, lived with the pandemic for so long, we know that the pandemic has impacted specific communities more than others. There are disproportionately impacted communities. And the LGBTQ plus community, they have their own unique experiences when interacting with the healthcare system. And there's a conversation to be had about the intersectionality of each individual. So if you are a part of the LGBTQ community, but you're also experiencing another risk factor, those risk factors in combination, and these factors of who we are and how we live can impact how you interact with the healthcare system. And that's why it's important to talk about how COVID impacts this community, because it does make a difference on how you interact with various communities. Or various aspects of the healthcare system. Are you, receiving care at a primary care physician's office, or are you relying on a clinic? Are you comfortable, or do you have a trusted healthcare provider or care team that you feel like you can ask questions based on your lifestyle, your coexisting diseases, and things like that. So it's just to acknowledge that, like I said, this community does have different experiences, and in honor of Pride, we want to be able to highlight that and make sure that this community is aware that we're here to answer their questions. So specifically, we want to talk about those who are currently living with HIV and how COVID specifically impacts that area of the community. So those with who are living with HIV may be concerned with how this affects their risk for severe illness from COVID-19. HIV is a disease that specifically attacks the immune system, and with that, those infected with HIV can experience more infections and more risk for infections, a higher risk for the inability to fight off certain infections and diseases. And because of that, those with HIV have higher rates of underlying health conditions that can make them even more likely to get seriously ill if they get COVID-19. So the vaccine series that you follow depends on the type of vaccines you received initially. And like I said, that's where your healthcare provider, your care team can really come in handy to make sure that you're getting every opportunity to get vaccinated and not missing any opportunities, getting over vaccinated or under vaccinated. So that's where your care team can come in handy if you are living with HIV. However, it's generally recommended that some people who have advanced HIV, including AIDS diagnosis, or have HIV and not taking HIV treatment, should get an additional primary shot. So that kind of falls in that, if you think back a couple slides, that group of the immunocompromised recommendation, and following that recommendation to make sure that you're adequately vaccinated and protected. Again, I can't express enough how important a care team is when navigating this intersectionality between HIV and COVID. And I also want to express that you do not have to be a part of the LGBTQ community to have HIV. We are just utilizing the background, the backdrop of Pride to specifically highlight this issue within this community, because like I said, this community has unique experiences and how they interact with their healthcare system. And we want to make sure that we have a spotlight to where their questions can be answered, especially about HIV, as we continue to highlight the importance of HIV detection, treatment, and same with COVID. All right. So next we're going to talk about long COVID or post-COVID conditions. So long COVID is the experience of after you have kind of reached that point where you're feeling you're not able to spread the disease anymore. I won't say it's after the point where you're feeling better 100%, but you're still feeling some symptoms. You have some lingering symptoms that aren't going away days, weeks, months after a negative test. And Unfortunately and fortunately, avoiding infection is the best way to prevent long COVID. However, there's no foolproof 100% way to avoid infection, which is why it's important to educate everyone about long COVID. So again, unfortunately, there is a lot we don't know about long COVID and its symptoms, which is why care and treatment can be limited at this time. But data has shown that long COVID is a risk for those who even experienced a mild case of COVID-19. So I know that there was some murmurs of that, if you have a severe case of COVID-19, that's when you're at risk for long COVID. But the data is showing that if you had a mild case of COVID-19, that you can still be at risk for long COVID. For example, when I got COVID-19, I had a fever and I lost my sense of taste and smell. Otherwise, I felt okay. So I would consider that a mild case for me. And even something mild like that and no need for increased medical intervention, like going to the doctor, going to the emergency room, or anything like that, there is still a risk for long COVID. Some early data suggests that mRNA vaccines and Paxlovid both help decrease the risk of developing long COVID symptoms, but more research is ongoing. And what I want to especially highlight is that throughout the pandemic, there has been conversations about alternative treatments for COVID-19 or long COVID. And it's important to know that some of these recommendations and alternative treatments that you see on, Reddit, Facebook, different news articles, they are not, one, FDA approved for that specific treatment of COVID-19 symptoms, long COVID, or the prevention of either. And they might not be effective, and they could even be harmful to you. So it's important to truly steer away from taking an alternative treatment without consulting a healthcare physician. These aren't like taking Advil for a fever. Some of these alternative treatments can truly have a detrimental impact to your health. And I want you to be conscious of that when you're seeing all of these alternatives. And you really have to be skeptical and use your skeptical mind when you're seeing these alternative treatments circulating. So in terms of resources, your doctor is your best bet. They can rule out other potential causes of your symptoms and refer you out to appropriate specialists. So for example, if you're experiencing some type of chronic pain or chronic fatigue after being diagnosed with COVID and attempting to recover from COVID, your doctor can rule out other causes of that pain or fatigue or other symptom. For people who don't have health insurance, it's encouraged that you check with your community health centers or your local health department to see what free or low-cost services are available. And you can also ask your doctor to refer you to a long COVID clinic or specialist. They are popping up more and more. And there are post-COVID care centers in nearly every state, but there could be a wait list or they require, proof of a positive PCR test. So again, utilizing your doctor to help you manage that referral system could be really helpful if that's something that you are interested in. All right. So we'll wrap it up with our frequently asked questions. First question is, why should I get and stay up to date with my COVID vaccine if I can still get infected with COVID? And I think this is really important when we're talking about that backdrop of long COVID, is that avoiding disease, preventing disease is the best bet that you can have when you're trying to avoid negative disease outcomes, and whether that be severe illness. Not everyone has a mild bout of COVID. Some people are more at risk for severe COVID, but sometimes it just hits others a little bit harder, and you're looking at more time off work, a longer recovery time, interacting with the healthcare system a little bit more, and all of that can be, time consuming, frustrating, costs more money, and so avoiding these outcomes is best achieved through vaccination. And being up to date is very important when you're talking about avoiding infection of COVID-19. So that's the best. That's why vaccines are important. But when we're talking about why is it important when you can still get infected, is it can also decrease the severity of your infection. If you are infected, you can have an easier go at it and recover a little easier with your vaccine in your belt. So that's kind of why you want to stay up to date, even though you can get COVID with the vaccine. They're not 100% foolproof, like we were talking about earlier, but it's still our best bet. And then we always talk about on Vax Facts and FAQs, coupling it with other preventative measures. So if you're in a crowded area, maybe you wear a mask, or you're monitoring community spread through hospital admissions, and your county's orange, and so you want to up the measures that you take. Or maybe you are immunocompromised and you never stopped these measures, and you want to continue to protect yourself the best way you know how. And vaccines is that. Will COVID vaccines prevent me from infecting others? So vaccines, again, are 100% foolproof in preventing community spread, but the data is showing that it helps. And ultimately, if you are infected with COVID and you have a positive test, you want to follow the CDC recommendations for isolating and quarantine, so that you don't infect others. It's not 100%. Do COVID-19 boosters weaken the immune system? And I think this is a question that kind of circulates every once in a while regarding boosters and the primary dose, of whether, our natural immune system is able to fight off the disease, and by providing or by getting the vaccines or the booster, that you're weakening their ability to you're weakening the immune system's ability to respond to infection, and it's the opposite. Scientifically, the boosters and the vaccines work by introducing or reintroducing, if it's the booster, your immune system to the virus, to COVID. So if it does encounter COVID-19 again, it already knows how to respond and already knows how to fight it off. The vaccines are kind of like a cheat code for your immune system, so that the next time it pops up, COVID and other vaccine preventable diseases. If you have the vaccine, your immune system is more prepared to fight off the disease, and that lessens the toll that it takes on your body to fight off the disease, because that's, part of what makes us feel sick is responding to it. So by that, I mean, when we get the vaccine, experiencing fever, some arm soreness, fatigue. I had fatigue pretty good when I got my COVID-19 shots. And that is my body's immune response to the COVID-19 vaccine. And that's my body getting ready so that next time my body sees the COVID-19 vaccine, it's ready to go and it knows how to fight. So truly, it makes it strong. Now, there is some research that suggests that, having natural immunity, as it's referred to, or when you contract COVID-19 and fight it off without the vaccine, and the immunity from the vaccine coupled together does provide a great deal of protection. However, you can get a lot of protection without having to get sick from COVID-19. So I think that is preferred, is to not get infected. And so that's the immunization route, increasing your chance of not getting infected while still getting that immunity. So that is our Vax Facts and FAQs for this month. I appreciate you all watching. As always, if you have questions or feedback, you can reach out to us at reach@nkfm.org, or you can visit nkfm.org and view all of the resources that we have and the programs that we have to offer at NKFM. So again, thank you and have a great rest of your day.